let me just see if I can find my, I had it a minute ago. There it is. Great. Okay. Many thanks to WHO for leading this effort, and congratulations on having the fourth WHO Infodemic Management Conference. As Christine mentioned, I'm Patty Michelle. I am a co-founder along with Peter of Health Enabled, and really thrilled to be presenting this work that was largely led by Peter and a colleague, Sarah Cheney, in support of a larger effort that we are working on with Gavi, the Vaccine Alliance. So really quickly, to give an overview of this work that we did over the course of the last few months, Health Enabled facilitated the landscape of the state of digital technology, innovations, and approaches to collect and use social listening to increase and support demand for immunization. This is part of a larger collaboration that Health Enabled has with Gavi, the Vaccine Alliance, to really look at the effective use of technology and data to advance immunization coverage and equity. This project was done in very close collaboration with UNICEF, with WHO, as well as the Vaccination Demand Hub. And it involved a range of methods, including, really looking at the literature and the state of the evidence, key informant interviews, and then learning from country COVID-19 experiences. When we were looking at this, we were looking at sort of immunization demand in its broadest sense. So really looking at really strengthening and understanding the dynamics in which social listening can be leveraged to improve immunization demand. And immunization demand is strong when individuals and communities seek, support, and advocate for vaccines and immunization services. So wanted to share sort of some of what we found in the literature. And so when we were looking at the literature, we were really looking at the evidence, experiences, lessons from applying social listening to inform and improve immunization programming. And what we found was that a lot of the literature was disproportionately focused on data sources and digital technology for the collection and analysis of social listening data, but less on how those insights were being applied and fed into the health system. And so as part of that review, we found sort of one really seminal paper that would strongly recommend to anybody at this conference to really take a look at, where in Europe, social listening was really leveraged effectively to help inform a policy development and to prepare responses to HPV vaccine rollout. And so in this case, it's one of sort of the rare examples that we found in the literature where there was sort of the full range of the experience to really leverage social listening, from the listening piece to the understanding piece, really looking at content analysis, understanding themes, representing public concerns and information gaps, and then engaging in the development of the policy statement, as well as response to concerns in real time. And so this was sort of a really nice evaluation that sort of demonstrates the real potential that a lot of these methods are now starting to show. when we were sort of looking at sort of the range of frameworks that were out there within which to sort of build the work that we were doing, what we found was sort of a number of frameworks developed really around, vaccine uptake, the BSD model on increasing vaccination, a broad spectrum of vaccine intentions, and then the caregiver's journey for immunization. And what we found sort of through the sort of analysis of all sort of the relevant frameworks on the intersection between social listening and immunization demand was that there are sort of a number of sort of key drivers that a lot of them share in common. One is really around trust and trust in people, institutions, and local determinants of trust. So leveraging social listening to understand the state of trust, as well as to then respond to that. Looking at also sources of community influence, the vaccine decision-making process, including the social and contextual influences, community access to services, quality of care, interpersonal communication, and client perceptions of services. I mean, one of the other things that we saw in the evidence is that often, social listening is sort of limited to online listening without really looking at sort of the full range of social listening with the inclusion of traditional media analyses, as well as general survey data that can be leveraged to really understand public sentiment. Well, we found through this process that it was really important to kind of ground the work in the journey to health and immunization. And through that, we developed some key use cases for the effective use of social listening to improve immunization demand. These use cases sort of follow the full journey to immunization, and it begins with knowledge, awareness, and beliefs. And so really looking at what are the perceptions and beliefs about vaccination. And in this area, and this is probably the area where social listening has been leveraged the most significantly, social listening can be applied to understanding the barriers and gaps in knowledge regarding vaccines and how to access services to inform communication strategies. Some of the relevant sources of data are open dialogue channels, dedicated surveys and polls, and routine program data collection. The sort of next sort of phase in the journey is really around intent. And so looking at the attitudes, perceptions, and decision-making that influences the intention to vaccinate. And here social listening can be applied to identify issues and topics related to immunization, including rumors and misinformation, to inform risk communication strategies. And we see sort of in these sort of first two groups is really where a lot of the current work on social listening has been applied to address issues around vaccine hesitancy, as well as to really address misinformation. Some of the relevant sources here within intent are really open dialogue channels, online media monitoring, community sentinel reporting, and then looking at traditional media. So in the next sort of phase in the demand, immunization demand and journey for immunization is really around sort of positive experiences with quality, appropriate, and accessible immunization services. And here, social listening can be applied to identify service delivery units or systems in need of targeted improvements to reduce supply side barriers. And so really looking at some of the relevant sources of data here are around targeted polling and crowdsourcing, citizen reporting and feedback channels, observation, and and interviews, in particular exit interviews around sort of quality of care. And then there's the after service. And so, information and motivation to return for follow-up. What you want to have is sort of people feeling very confident and supported in their immunization journey. And so really looking at information and motivation to return for follow-up, reporting side effects, and then sharing positive immunization experiences in the community. And I think that's one of the things that we've, seen and learned a lot through Heidi's work is that sort of peer acknowledgement can go a long way of having sort of peers express positive experiences with immunization. Social listening can be applied to track adverse events following immunization and vaccine safety concerns as part of a system for rapid investigation, response, and follow-up. And here, some of the relevant sources of data are, client and community reporting mechanisms, and then also like health facility reporting systems. Some of the cross-cutting themes, within the journey of immunization for which social listening is very relevant and can be used and leveraged is really around trust, influence, gender, and equity. And so really, understanding the perceptions of the institutions providing the services, as well as understanding individual agency to make decisions related to immunization. And then, social listening can help identify trusted sources of information, community leaders, influencers, and then identify barriers to demand that stem from inequity. In the health and political system, the influence of social and the political enabling environment to support immunization demand. And I think there, social listening can help understand barriers from policy or systems and suggest solutions and advocate for change. And so with that, I will hand over to Peter, but just really want to express my appreciation to Gavi for their support of this work, and all of the collaborators who really shared their experiences and our key informants for sharing their experiences to feed into this. So over to you, Peter.
Great, thank you very much, Patty. And thanks to Christine, Tina, Jaya, Tim, and all the people who have organized this wonderful conference I've been enjoying for the last few days. It is an honor to speak to this community. Following on from Patty, there are a whole range of different data sources that should be considered under social listening. Yes, in the first block here, there is the monitoring of public exchange, such as social media. But there are many other ways. There's ways that the health system actively can find information, qualitative and quantitative, such as KAP surveys, focus groups, and the rest. And even data generated by the health system, such as routine surveillance. So the point here is that there are many different data sources, not just what we're often talking about, the digital social media scraping. And the key point is each of the data streams has value, and we should try and get to triangulation from as many different sources as we can. The model that we came up with fairly simply is this. There's the range of different data sources coming in from the left, structured, unstructured, some very, very fast, like almost instantaneous social media, others much longer term surveys that take months, even many months to pull together. All of that goes through the process, get data coming in, the analytics, filters, visualizations, artificial intelligence, and importantly, human insight. It can't just all be algorithms. People should understand and take a view of what's going, all the data that's coming through. And all of this obviously is just to produce insights that can be acted upon to increase demand for immunization. And probably the key point to come out of what Patty was just saying is that, yes, we can respond through communications, but there's only one of many different ways that is relevant to respond. A lot of this to be about improving the health system, improving the accessibility, building trust in these systems. We had the pleasure of speaking to about people in 12 different countries, and we wrote case studies on the 4 you see at the top right of this page. And last week on Tuesday, we heard from many impressive countries of the work that they're doing in this. And we similarly learned of excellent work that's happening. But one point I would actually draw out, what gets written up in case studies and in global webinars like this are the best cases where people are proud of what they're doing and wanting to demonstrate what they have achieved. But this is actually quite new and quite hard. For an overstretched national Ministry of Health, with only a few people, say in the communications department of either risk communications and community engagement or the extended vaccine program, this can be a huge amount of extra work where there isn't enough resources and capacity. And even if it is, the assistance is provided for free, there is an opportunity cost. The very fact of these overworked people focusing on this rather than their other tasks can be a drain on the health system. So the issue is, does this add additional value to the other work they would have been able to do anyway? So a key point that's going to come through is there's a huge need for building resource and capacity. And there's a number of strong initiatives, as you know, such as the Vaccine Demand Hub, that is doing excellent work in this, UNICEF as well with Talk Walker. So there absolutely is a role for regional and global support. I live in South Africa, and I'm actually in the risk communications and community engagement team. I'm the convener of the social listening and infodemiology team in the country. And as in so many countries, we're trying to identify and focus on the movable middle. In our case here, about 35% who could be persuaded to take a vaccine, but that's the effort we have to do. And we've set up a social listening system with data coming in from many different organizations. And South Africa is a reasonably well-resourced country, but even here, it has been quite challenging to get everyone involved. And in particular, we've received a huge amount of support from the Africa Infodemic Response Alliance, the regional body supported by the WHO with many other partners. And I'd like to acknowledge and thank Elodie, Aurelie, and Halim, who provided a huge amount of support for South Africa. So what we came up with was the process maps, and many of you who have read that vaccine misinformation management field guide will recognize where much of this comes from. Step one is assessing the bottlenecks. What are we trying to achieve? What is it that prevents vaccine demand happening? So what is social listening trying to identify? Step two, finding all the data that you can pull together. And step three, the partners that you can build upon. For example, in South Africa, as well as all the electronic systems,
1 minute.
There's the Red Cross has got, I'll move on faster, going through the different stages from understanding, engaging, measuring. The recommendations is a number for the implementers of these projects, a need to build on the evidence, build the partnerships, develop capacity, policymakers, build the, again, resources and capacity, and think through the legal and ethical frameworks. Researchers, there's a real issue on how to integrate all the different forms of structured data and the theory of change. We don't fully know how to go from identifying narratives to leading to people going in to get the vaccinations, and much more work on the behavior change models, the BESD model you may have come across, and advice for the funders. My final slide. So the reflections we found from this is that yes, social listening tools are powerful, but it can be difficult and it is not yet fully proven. In the last few days, extraordinarily sophisticated and interesting work going on here, but it is not yet demonstrable how this directly leads to more demand for vaccinations, more than other ways of gathering information much more traditionally. We need to consider through the whole caregiver's journey, not just on the communication piece that a lot of the infodemiology focuses on. And please think of this social listening as a doorway to community engagement. It's not just understanding concerns and spitting back a message. Genuinely, this is a way to listen and understand and treat with respect the views of what it is and isn't working in the health system, people's perceptions. Sometimes there really are problems. People aren't treated well in facilities. Refugees aren't allowed into to get good services. So the key point is treat social listening as a way to understand perceptions that lead to action, not just communications, but changes in the health system to respond to what you are hearing. There really are huge issues of equity in, through this. Whose voice is heard, listened to and responded to. Often there's a big gender imbalance. For example, if it's all digital, who is to the cell phones? Throughout the whole point, we need to build capacity and make sure it's adaptable locally. And so there's a huge potential. This is a really exciting area for public health, but we've not proven it yet. It's lots of interesting thousand flowers bloom, some stunning examples. We haven't shown yet how the investment in digital social listening directly leads to greater significant numbers of people getting vaccinated or other health concerns. So with that coming to an end, thank you very much for the time. For all the organizations who have worked with us, Gavi, UNICEF, Vaccine Demand Hub, with support from the World Health Organization. Sarah Cheney, who is the other member of the team who did a huge amount of the drafting and research for this report. Thank you very much for your attention.